Well, thank you, Rob and Ian, and welcome everyone to the university. I'm particularly pleased to welcome you on the eve of the 70th anniversary of the NHS, which of course is the 70th birthday next week on the 5th of July. I worked in the NHS, as Rob's alluded to, between 1974 and 2000, before I kind of took on, if you like, a second career in higher education. And in fact, I was the chief executive of NHS England at the time of the 50th anniversary. So that kind of ages me beautifully. And in that period through the 70s and 80s, I was thinking back this morning as to when my first encounter might have been with art and health. And in fact, it was an encounter with art and hospitals, so very narrow. But in 1979, I was part of an initiative at the King's Fund in London, which had, this was the language of the time, I suppose, the objective of, quotes, brightening up the highly medicalised buildings of the NHS. And of course, in London at that time, some were a bit kind of ancient and slightly dreary, maybe fantastic buildings, but not so good inside. And others had been through that kind of period of adopting the brutalist architecture of the 60s and 70s. So there was a kind of theory at that time that if you just put up a few nice pictures around the place, everyone would be happy. So this was narrow. It was visual art in hospital settings, and whilst it might have been uplifting for some, I think mainly the staff and not the patients, it really had more to do with the past than the future, and very little to do with patient care and health outcomes. So it was more of a throwback, if you like, to the, and you see these all over Europe, in France and Italy particularly, but also in London, if you look hard enough, the kind of spiritually themed works of the medieval period, and also work relating to the philanthropic endeavours of 18th and 19th century artists who were very keen to support healthcare activity in the form of hospital. Today things are very different, and I think very exciting. So we've been hearing about the government initiative, but of course Arts Council England's Culture, Health and Wellbeing Alliance is important. The National Alliance for Arts, Health and Wellbeing, I think, gives a voice to this issue, and also a resource for arts and health activity. And there are some tremendous projects. Some I know about just through kind of personal contact. So I'm very interested in the London Brain Project, which brings art and neuroscience together to explore brain injuries in children. And I'm very familiar, because my daughter doesn't stop talking about it, with some of the Scottish initiatives in dance. So Dance Base, the Scottish Contemporary Dance Centre in Edinburgh, and Scottish Ballet have been drawing on techniques, I think, developed by Mark Morris in Brooklyn, to develop dance as a way of supporting people with Parkinson's disease. And also, more recently, they've been working on Alzheimer's disease, and doing so with Alzheimer's Scotland, the Edinburgh Festival Theatre, Scottish universities, music in hospital, hearts and minds, and arts in healthcare. And I pick that example just because it's different. I know there are just as good examples in Yorkshire, but you're going to be hearing about these later in the day. But the excitement now, therefore, is direct contact with patients and with the wider community. And I think, as we've been hearing, much stronger support from clinicians and clinician scientists. There would be a lot of poo-pooing of this sort of thing, even 20 years ago, certainly certainly that through that period of the kind of 80s and 90s. But now it's something that's taken seriously, and the clinical community, for example, the neurosurgeons in Edinburgh working on Parkinson's disease, are all focused on these sort of issues, and see the advantage of collaboration. And now, of course, as we've been hearing, collaboration across statutory sectors, but also the arts and charitable sectors. So, as I see it, today's symposium will explore both the ways in which participation in the arts can have a positive impact on health outcomes, and the ways in which the arts and humanities, and the researchers in these fields can help us to question, to understand, to communicate developments in health and healthcare. And universities as platforms for the arts and facilitators of health research, I think, have a significant role in trying to draw the two together. So arts and health is not just a key interest for the government, as we've been hearing, and it is such a beautiful report. I must have read hundreds of government reports over the years, but the all-parliamentary group report, as you've heard, on creative health is certainly one of the more beautiful. Both arts and health, therefore, are central to our research at this university. We have a great tradition in both fields, and two of our major systemic research themes are culture and global health. And of course, we also have great strengths in medical humanities, in our special collections and artifacts, literature, both reflected, I think, in today's programme. Our research here is interdisciplinary, it's impact-orientated, and I think, therefore, has to be outward-looking. That's almost non-negotiable in universities. Because to achieve progress, we need to ensure that our research is user-led and solution-focused. We have to be clear that we're able to combine disciplinary excellence in broader interdisciplinary teams which stretch beyond the walls of the university, and that means working with external partners nationally and internationally. So Sue talked about the importance of the Cultural Institute in the university, and we already, as many of you will know, work extensively with the creative and cultural industries in Leeds and beyond. So in this field, we want to work together more to support research which helps people to understand and interpret and imagine solutions to the challenges of health and well-being. And this doesn't just apply to Leeds. We have to look to survive now as a university. We have to look internationally. So at the moment, we're working with schools and public health practitioners in India, Malawi, Uganda, to explore the use of creative arts as an educational tool in sexual and reproductive health. But of course, from these countries, you can carry back lessons that have local application. In health, we work right across the spectrum. I like to think of it as working from the cell to the community. So at one and the same time, we're studying life in molecular detail. At another, we're supporting people with cancer, cardiovascular, musculoskeletal, neurological diseases to have a good quality of life, and to have a good quality of life, we hope, mainly in their homes. So drawing on my Parkinson's and Alzheimer's examples, it's pretty sobering to note that neurological disorders around the world affect 1 billion people. And okay, that's a global figure, but it's a major issue in this country and in this community. The other thing we're very interested in at the moment, working across the boundaries with arts and health, is in antibiotic resistance, major public health issue, as the Chief Medical Officer and Ian, people like them, keep reminding us. That is another very current interest in the university, and that is something where it's estimated could result, if unchallenged and not dealt with, could result in 10 million deaths by 2050. So my point simply is there are plenty of big challenges out there, exciting challenges at the boundary of culture, health and well-being. And I hope today will reinforce that, but I also hope it will inspire new partnerships, perhaps new projects that work across disciplines. I hope that you feel able and comfortable enough to draw on the research expertise in the university, in our Faculty of Medicine and Health, in the Cultural Institute, and in the Leeds Humanities Research Institute, all of which you'll hear more about as the day goes on. But thank you again. I'll finish where I started by welcoming you all to the university, and I hope you have a good day. Thank you.